The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm talking today with Dr. Jersey Chen, and Dr. Chen's assistant professor of medicine and cardiology at Yale. He's the first author on an intriguing article about to be published in JACC that deals with the amount of radiation exposure that individuals are undergoing in the United States due to cardiac imaging procedures. So tell us a little bit about your study, Dr. Chen.
Well, this is one of the first studies to look at cardiac radiation exposure from cardiac procedures on a population basis. So we took a large data set of privately insured patients, over 900,000 patients, tracked all their cardiac imaging procedures that used ionizing radiation, tabulated it up over 3 years, and then see how many patients received a large amount of radiation.
And what did you find?
We found that approximately 10% of the population received a cardiac imaging procedure that involved radiation. On average, the patients who did have a cardiac procedure received 15.6 millisieverts of radiation over a 3-year time period. And that's about 5 times the annual rate of radiation received just from background sources in the United States.
So you found a fair degree of exposure to radiation. I assume most of it was from radionuclide procedures.
That's right. About 3/4 of the radiation exposure was due to myocardial perfusion imaging, such as SPECT or PET imaging. And almost another quarter were due to cardiac catheterization and stent implantation procedures. And the remainder were due to smaller radiation doses from electrophysiology procedures and very small amount from cardiac CT.
So when were these data gathered? Was a lot of cardiac CT being done at that time?
This was done during 2005 to 2007, so there wasn't that. The amount of cardiac CT was actually not high at all. So in contemporary clinical practice, most likely to be higher.
Yeah, I was struck by the fact that there were a small number of individuals who had received really very, very large doses of radiation.
There were a few thousand people who received much more than 50 millisieverts. In fact, the highest amount was almost 550 millisieverts. Of this group, there was several thousand people who had more than 5 cardiac catheterization procedures and more than 3 myocardial perfusion imaging procedures during this 3-year period, accumulating to a very large radiation exposure.
Yeah. Of course, that brings us to the most important question of what it all means. As I recollect, virtually all of our understanding of the cancer risk of radiation exposure comes from the atomic blast in Japan. And in fact, there's very little data where specific cancers can be attributed to radiation exposure in individual patients. So what's your interpretation of the meaning of the radiation exposure you found?
Well, the radiation exposure meaning, that certainly some of the radiation exposure is most certainly appropriate and justified if a patient needs multiple stents or if they need multiple procedures. I think what this study shows is that there are some instances where perhaps radiation can be reduced. For example, in young patients, aged 19 to 35, there were a number of these patients who received on average 15 millisieverts, and this population will probably have the highest cancer risk because of their young age. Whether these individuals, and most who actually mainly had most of their most of their radiation exposure from myocardial perfusion imaging could have a substitute procedure such as stress echocardiography or even an ordinary exercise treadmill remains to be investigated to actually reduce their long-term risk.
So I think you make a good point. Certainly that if diagnostic radiation exposure is required for the clinical condition, that we ought to go ahead and do that. Whenever possible, we ought to limit radiation as much as possible. Very interesting data that you've reported for us. Thanks very much for being with us.